Life is magic, is philosophy and science, is sky and earth. That is why I was charmed in Ayurveda, because Ayurveda is the only science that describes the philosophy of life and the science of life, describes the psychology and all the details about disease. But to be charmed in anything, you need a magician. And this is Vaidyasvin Bharot. I have never met a man who did not combine philosophy together with total scientific approach to health and disease. And before that, what was I doing? I had worked in an intensive care unit in the main chest hospital in Greece, in a renal unit in the Naval Hospital, and I was doing research in asthma in the Manchester Royal Infirmary. And why was I charmed after all these modern concepts of medical career? Because I saw in Ayurveda the future of medicine. I saw genetics. I saw individualized care in an integrated way, importance of nutrition for patients. Concepts like Pakvasaya Kati Sakti, that the residence of Vata is below the navel, are the modern concepts of gut-brain axis. How did they know it all? How did they know? This is what Vaidyasvin Bharot says even now. How did they know? This is the mystery. But Ayurveda has to be applied in action. I'm in the Holistic Health Center in Athens, Greece. I'm the director of the Holistic Health Center. I'm the advisor of the Global Agrikarma Center in Ahmedabad, India. Patients come to Ayurveda because they have either psychosomatic problems or physical pain. And we have ways to help them. We give them herbs like ashwagandha, brahmi, kotkola, shatavari. We have techniques like panchkarma, sirodhara, nasya. But there are not enough herbs for all the ailing population of the planet Earth. Few years ago, Vaidyasvin Bharot rediscovered the method of Agni Karma, described in Sushruta Samhita, for the relief of pain. In the last 4 years, in the Global Agni Karma Center, we have seen more than 40,000 patients with chronic pain. We have seen as well patients with migraine that becomes an epidemic in the modern years. I love integrating medicine, putting modern and ancient together. We have devised, together with Dr. Camillus Power, the ex-dean of Faculty of Pain in Dublin, Ireland, protocols. So all these patients who are treated, we have proper data, we have evidence, we have videos, so everybody can learn from this application of Agni Karma. We use a herbal cream that helps the patient not to feel any pain after the thermal microcautery. We have done research in America for this cream. So, putting things together, putting modern and ancient, modern research, ancient slokas from books, this is what I really enjoy. This is what we do together with Vaidyasvin Bharot. We have published work in medicine. We have published work for the treatment of knee osteoarthritis and thermal microcautery. We have applied thermal microcautery in Dublin, in the NHS hospital, with Dr. Camillus Power. We have used Agni Karma or thermal microcautery in a main hospital in Athens for treatment of migraine. Again, published this work. This is, I believe, is the future of Ayurveda, putting modern medicine and Ayurveda together. Look at the ancient book of Sushruta Samhita. Sushruta Samhita described health in an amazing definition with a lot of depth. Sushruta Samhita, Sutrasthana, chapter 15th, Shloka 33. It says, Samadosha Samagnischa, Samadatu Malakriyaha, Prasanat Mendriya Mana, Svasta iti abidiyate. Everything is there. Samadosha. You have to understand Ayurveda through modern neuroscience. Vata is automaticity. Pitta is metabolic factors. Kapha is homeostasis. Prasanatendriya manah. This is all the concept of stress described few thousand years ago. They knew it all. It is our duty to apply it now in a scientific way in the modern world. This is what we do together with Vaidya Ashwin Bharot. This is our dream. This is our vision. Ayurveda in action in a modern scientific way.